Bismillahirrahmanirrahim. Assalamu alaikum, everybody. As you all know, we have been organizing endoscopy hands-on courses both in the sphere of colonoscopy and ERCP for some time now. But this is for the first time that an endoscopic ultrasound hands-on course is being organized in this unit. We are grateful to Dr. Khalid Hassan and Dr. Mustafa, yeah, he is here, but Mustafa Araim, who have traveled from the United States. Dr. Khalid Hassan is, of course, used to this unit. He has been doing the ERCP courses for some time now. Also, we have Professor Gyasun Nabi Tayyab from Lahore, and Amjad Salamat, I don't think is here, but he will be joining us later. Anyway, I hope you all will enjoy this hands-on training. We'll learn from this and then go forwards and provide clinical care, and as well as providing clinical care, at the same time you will also teach your colleagues and your trainees in this art of endoscopic ultrasound. We are grateful to Dr. Sadnyas, who volunteers here in this unit and has been helping us now for more than, I think, it's 11 years. And again, he's the driving force behind this EUS course, although my name appears as a director, but he will be dealing with the whole organization. And thank you once again.
Thank you very much, sir. Now I would like to invite Dr. Saad Khalid Niaz, who's Director Endoscopy. He is a visiting faculty at Dow University of Health Sciences and now a member of our syndicate as well. Dr. Saad will give you a brief introduction of our faculty as well as the course.
Bismillahirrahmanirrahim. Assalamu alaikum, everybody. I would like to thank Khalid and Mustafa. Just a brief background. Khalid Hassan comes from Florida. He's working in one of the most advanced centers in EUS and one of the busiest ones, where he's also director of their fellowship program. So we're really fortunate to have him here, and he comes regularly, helps us with the ERCP course as well. Dr. Mustafa Rai has come from San Francisco, has landed in Karachi at 4 in the morning. Khalid came 6 in the evening, and they're both flying out tomorrow. So that's a really huge undertaking, flying from West Coast all the way, I don't know, 16 hours? With the stopover, maybe 22 hours, I don't know, yeah, something like that, and 20 some hours for you. So we are really grateful for both of them. Mustafa is actually an associate professor, Mustafa, at University of San Francisco. And he's also director of his training in EUS and advanced endoscopy. So we're really fortunate to have these two who are working in US. Of course, Gyasun Nabi Tayyab is here, who is the principal of Amiruddin Medical College in Lahore, and is been looking after Lahore General Hospital's entire endoscopy. He's he works in one of the most, or leads one of the most advanced endoscopy facilities in Lahore, and also has been very active with FCPS. I remember he was the head of, or leading the gastroenterology in FCPS as well. So he needs no introduction. We're very grateful to you for traveling, and especially also bringing your Begums up. Amjad is not here, but Amjad Salamat again is a very big name in Pakistan, from Pakistan Army. He's now working in Quaid-e-Azam Hospital, and he's a professor there. So I'm very grateful to all the faculty that has traveled from overseas as well as nationally. Okay, we've so far done 12 colonoscopy courses in this unit, hands-on. And when I say hands-on, our courses are so some of you have attended, are pretty intensive courses for 3 or 4 days, depending on whether you do colon or ERCP. And we have done 6 ERCP courses so far, so this is our first EUS course, and it's a dream for all of us working here. The team here in Surgical 4, we've been working towards doing something like this at this side of the country. We are very grateful to AEG, which is Asian EUS Group, who is actually sponsoring this course and has supported us. It's a very good forum for those who are actually wanting to even do EUS, or those who are doing EUS, to get involved in this forum. Very supportive for both basic training as well as advanced training. Something to look for. You should go and Google AEG and then read about it and see how you can be affiliated or benefit from it. Now, this is the first time we are doing this sort of a course, especially in EUS. And we've been thinking and changing our minds, because we didn't have a format to do a hands-on course. The sort that we do in ERCP and colon is actually taken from UK. So we have actually not invented anything there. We've changed a few things according to our own facility, etc. But we've got the syllabus, the whole thing was something that was done in UK. The problem with EUS is that the sort of hands-on course we wanted to do, we didn't have a format for it. So this is the first time you're going to try it, and I hope it's going to be good for you. And if there are any shortcomings, being the first course, obviously we'll hope that you'll excuse us for that. What we intend to do is, obviously we have got a pretty comprehensive theoretical support, but it's hands-on that you're here for, especially those who are on the 6 hands-on candidates for this course. We have 3 EUS rooms, and what will happen is that each candidate we hope to give 3 cases, and that would be with one of the faculty, whether national or international. And if time allows us, then we would like to give you 4, but 3 for sure, inshallah. And during that time, we'll give approximately 20 to 25 minutes at least to a candidate to understand what is being done, how it's done, for them to do it themselves, as well as to understand where they were not able to get something, how the trainer or the faculty actually does it, and how you're supposed to do it. It's very difficult to get cases that are going to be simple just for EUS. It's not just possible for us to get normal patients and start doing it. So we've obviously got patients who've got pathology. We have been selective, but really it's not been possible. So we have a very wide mix of cases, a lot of pancreatobiliary cases, which is our mainstay of our unit because of our involvement with the pancreatobiliary diseases. So we hope that we'll be able to give you theoretical as well as practical demonstration of how things are done, and then obviously this is a basic or foundation course, and so the idea is to give you the right concepts for you to build upon. And obviously towards the end of the course we would be really looking for advices, suggestions, so that we can improve it next time around. One of the positives or negatives, I'm not sure, are that we are only going to be doing linear EUS. We have a radial scope. It just actually broke down, so we currently don't have it, but in the unit we do. But hardly ever are we using radial EUS now, and in our practice. And that is generally the practice. Most units that you would be working for are likely to have a single scope. Initially at least, and the likelihood is that you're going to get EUS scope. It's very unlikely that somebody is going to buy you both scopes, and I don't think that as time goes on, and the other faculty obviously will surely give their opinion, but I feel EUS linear scope is the way forward. You can do therapeutic stuff as well as diagnostic stuff for almost all the things that we deal with. So that's one of the things. We are only going to be focusing on linear. We're not going to be. The disadvantage is obviously we are not touching on radial, but the advantage is that because of the difference between the two in terms of pictures, what you see, how the organs appear, and the uh, uh, concepts and understanding, I think it will be better to focus on one first, in my opinion, especially in the early days, because when you start seeing the same thing but two different views, it's not always very easy to comprehend. So I hope that that turns out to be a positive in our course, but that also can be, one can say that we should have covered the radial, although I feel that we probably don't need to. We want this to be a very interactive course. This is not about the professors and trainees and all. This is about learning for the trainers as well as the trainee. So we want you to be comfortable. We want you to ask questions, please interact. That's where we learn, that's where you're going to learn. There's no point not asking, no matter how silly, no matter how simple the question is, just go ahead and do that. Okay? One announcement is about the dinner tonight. That's going to be at barbecue tonight, so we encourage and hope that most of you will come. Anyone who's from outside, they have any transport issues or they don't know the ways, etc., we can always help them out. I think that's all I had to say, and without any further delay, we should. Okay, so normally what we do is we introduce our candidates and they tell us where they are from, what they have done, so at least we have an idea about who has done what. So quickly, we would like the hands-on candidates to tell us where they are from, number one. Number two, have they had any EUS experience, and do they have EUS in their unit? Just the three things.
Bismillahirrahmanirrahim. My name is Nadeem Hassan. I'm a graduate of Dow Medical College, trained in gastroenterology in the United States, where I was practicing for quite a number of years. Then I moved to Saudi Arabia. Predominantly, I've been involved in diagnostic and therapeutic endoscopies, including ERCPs. So at both those places, United States and Saudi Arabia, I did not have any experience with the US. Currently, I've moved to Karachi, and I'm working at Dow University of Health Sciences at OJA campus. We do have endoscopic ultrasound machine at our center, but I do not have experience in the US. So this is, I'm getting some hands-on here, inshallah ta'ala, which I plan to utilize it for the patient care at our center.
Yeah, one thing that's interesting is that our hands-on candidates come from all over the country, and we'll find out as we hear from them.
I am Dr. Gyasul Hassan, working as assistant professor at Lahore General Hospital, PGM Lahore, and we are using and we are quite familiar with EUS for last 7 to 8 years, and after the last GastroCon, we are pursuing it very actively, and weekly we generally do 20 cases, and under supervision I have done a few, and I can recognize major landmarks, and we are doing the intervention as well, like cystogastrostomies, choledochoduodenoscopies, and things like advanced malignancies, and sometimes staging of the tumor, and USFNA is obviously the regular work there.
Thank you.
Bismillahirrahmanirrahim and Assalamu alaikum. Dr. Asif Gul, Assistant Professor Gastroenterology, General Hospital Lahore. Have been working with Professor Ghayas for the last 7-8 years, and as Hassan told, we are very much familiar. Initially we did on Fusion on EUS, and then we have latest model of EUM2 with Olympus. I agree कि हम लोग weekly तकरीबन 20-25 cases करते हैं, both diagnostic and intervention. We have both scopes, radial as well as linear. लेकिन focus linear पर होता है क्योंकि therapeutics हमारे ज़्यादातर linear हैं, और ऐसे ही under supervision professor हम लोगों ने few cases किए हैं, but mostly in the observer status. Thank you.
I'm Dr. Rahmat. I'm from Hyderabad. Asian Institute of Medical Sciences. I'm working with Professor Sadiq Mehman. I'm FCP Smialis and I'm doing my second fellowship in gastroenterology. So I'm a faculty come resident at AIMS hospital. Until now we are not having EUS started, but we are looking forward to have this EUS at our center soon. So that's what we are starting, and we are in just beginning stage. So so my professor is very much ambitious to have this very soon. So he was intending to come here, but unfortunately he's not here. So and instead
He
of
preferred
I am
to
here.
go to Paris, which I don't blame him for.
Assalamu alaikum. I am Bakar Ahmed, consultant gastroenterologist at North Manchester General Hospital in Manchester, UK. I am clinical lead for hepatopancreatic biliary disorders and advanced therapeutic endoscopy. My first encounter with EUS was in 1990 when it was first introduced in the UK. And we were the second unit in the country to acquire it. And in fact, I worked on it for 2 years with my boss, charting out the various anatomical features. And then I left it completely for 20 years. I'm currently leading the hepatopancreatic biliary disorder, so that's why I thought I would start doing it with my colleague who's already providing the service single-handedly. I'm also privileged to be the faculty here for ERCP and colonoscopy. And in fact, there was a very good EUS course in Nice in south of France, but I opted to come here just to prove the point that the faculty and the standard of the courses that we provide here is absolutely world class, and which is a great tribute to our faculty and the organizers here. So, and also the second point is that you are never too old to learn.
I'm enjoying, Vakar is always here with me in the colon as well as ERCP course for the last 6 years. So 18 times we've always been together. This time is the first time you're going to give me actual feedback. Okay, we have a lot of observers and some senior ones as well. Oh, there's one hand on left. Okay.
I'm Dr. Rajesh, senior lecturer in the Department of Gastroenterology, SIUT. Recently we have Dr. Adil has joined us for EUS. We already had machine, and now we have started. I'm in observer status with him, and started to do just few stations now, and trying to learn the landmarks.
You have Pentax?
Yes, we have Pentax.
Hyderabad Pentax? Okay. Great. So I was just saying, thank you very much, Doctor. So it's a pretty wide spread. We have SIUT, Dow, Lahore General, and Manchester, and Hyderabad. And that's what we do in our ERCP and colonoscopy courses. So we have 5 candidates selected from different provinces or cities of the country. I'd like to welcome Amjad Salamat. I've introduced you in your absence. Thank you very much for traveling all the way to Karachi. I would like to just at least introduce the names and where they are from for the observers as well, because at least we should know who is who quickly. Sorry, Sajda. I Mansoor.
Assalamu alaikum. I'm Mansoorullah, professor of gastroenterology at Liaqa National Hospital. We don't have this facility available yet, but I am here to observe this to learn further things. Thank you.
Great. Sorry, Sajda.
I'm Sayyid Mudassir Laik. I'm assistant professor at SIUT in Department of Hepatogastroenterology.
Okay.
Assalamu alaikum, Ji. Dr. Muhammad Tayyib Usmani, assistant professor at National Institute of Liver Disease. I'm here as an observer.
Tayyab is an old face. He has come to our courses before as well.
Dr. Afan for Patel Karachi. Dr. Assalamu alaikum. I'm Dr. Zia, working at the gastroenterologist at Patel Hospital. I'm Dr. Atiq Abubakar. I'm currently working as assistant professor of gastroenterology at Al Iqbal Medical College in a hospital. I'm doing diagnostic and therapeutic endoscopies and ERCPs, but EUS facility is not available.
Where is that?
Al Iqbal Medical College in a hospital. Lahore.
Okay.
So 3 observers are still not here.
Okay, no problem. So now over to you. We want to get Dr. Khalid. Let's get. rules like